My name is Mark Lari Letoluo. I'm a community health volunteer. Mostly when I'm within the community, we help the community according to what I was trained to do. But my community has a lot of challenges, so I have to be here most of the time. I go to the manyatas, I see the air ventilation, I see if they have toilets, because we champion a lot for toilets and hygiene, washing hands. And then because of the corona season, I have to be in all major barazas and forums. I have to speak up, see that people are keeping social distance, they are wearing masks. The key challenges that we have here is maternal health care. You've seen that we marry a lot of women, then we have a lot of kids. You go to a home, say they have 10 kids. Challenge is getting the right supplements for the mother until they give birth. The other challenge of hygiene, we have a lot of maybe cholera cases, stomach, diarrhea is very common. So one of the challenges that the facility faces is not addressing those key issues. One, they don't have a lab for testing some of those things. They don't have the delivery coach for pregnant mothers. You find that most of the time we are called upon to take the pregnant women to the facilities. They don't even reach there. They give birth along the way. We have suffered a lot as a community in terms of teenage pregnancies. No community loves teenage pregnancy. Young men do not like to be seen carrying condoms. So majority of them will place condoms inside the bushes where they meet the green lodges. So over time these condoms get disposed by the sun, and then they can hide the condoms, go to school, come back and use the same condoms. We are trying to locate specific places of their own young people who have houses and are willing to house the condoms so that they can go and comfortably pick. Because when they come to a health worker, people will suspect either you are sick or you are going for the condom. Right now in our community is the moment where we have the largest number of young teenagers, boys and girls, ever in history of Maasai. Like you come to a family like this, we have over 20 girls, 20 boys. Staying at home due to COVID will create ways of them meeting. Right now it's like 6 months or 7. So they'll definitely meet. COVID has given the men a leeway. You seduce a girl, she rejects you, you stay a month, you go back, the boredom has broken her down. She'll end up accepting you whether she wanted or not. So we are trying to make sure that they know their purposes, giving them something to do, not just staying at home and then talking to their parents. This time a lot of parents are depressed. They don't have money, so they end up shouting a lot to these ladies.